So I would begin my talk with real-time physiological signal acquisition and Korean medicine. So as you can already, you have experienced that there's a big growth in the digital healthcare, and the interest on healthcare has increased a lot during the past couple of decades. And as similar to that, the population aging is a serious problem, especially in Korea, because people not having babies, and the average age of the population is growing up. So there's more old people, to put it simply, and old people have more disease and more problems with their bodies. So people are more concerned to their personal health, and the health market is growing up really fast. And also there's a demand for figuring out like what is going on with all these diseases, like before the symptoms come. So let's put it this way. In the old days, when you're sick, you don't really know what's going on to your body until symptoms come, right? So for instance, you have diabetes. You actually don't know what's going on to your body until something serious pops up. So that's the past. And nowadays, people trying to figure out like, oh, so I'm sick. What can I do about it? So people are more concerned with what is actually going on, and they would like to monitor the process or the progress of the disease. So this is the present. So there's what I could say is past simple medical devices people usually monitor or try to find out what the symptoms are and how the symptoms came. And nowadays, if something happens or if you kind of feel weird, people are more concerned. Like you would go visit the doctor, and also you purchase digital healthcare devices so you can keep track of like what is actually going on. And in the future, we're trying to find out ways to expect what will happen in the near future. Like if you have a very minor problem, will it be serious enough so that it would develop into a real disease or not? So this is, I guess, the trend of current digital healthcare. So we wanted to focus on this kind of approach so that we can keep track of what is actually going on. So we wanted to develop. So it's basically going to be some of the approaches that we have tried in our groups. So we first developed the ECG and EMG monitoring system so that we can actually find out what's actually going on to your heart, so that we can later on find out some mechanisms of your heart, and if there's a potential problem, can we actually find out what will happen? So the current problem of the ECG or EMG monitoring system is that you have to wear certain devices to your body, which is kind of heavy, and it has limitations such as the battery problem, or the patient cannot actually see what is going on to their body until you visit the doctor, and the doctor would put it in a special machine so that they can extract the data, and they can put it in the PC so that they can analyze it. So actually the patient will not be able to continuously monitor. So we want to fix this so that we can actually make the device very small, like this capsule type device, or like even a simple patch on the chest, so that we can actually measure your beatings of your heart, and then you would the device would send the data to your cell phone so that you can actually see that the heart signals coming out of your heart. So this was our first approach. Now from that, I guess this is more kind of a familiar topic here, because in this we have developed a system which can measure the PPG. So PPG is, I guess most of you have your smart watches, right? So on your smartwatch, the backside, there's a green light blinking, constantly blinking, and that light detects your blood flow on your wrist so that it can find out the BPMs of your body. So this is the technology called PPG. So PPG basically can detect the blood flowing into your wrist. So we use this to actually find out the PAT, which is a pulse arrival time. So when your heart beats, it sends out blood to your body. And if we know when the blood arrives on your wrist, we can calculate the speed or the velocity of the blood flow. So using this, we can actually predict or estimate the blood pressure of your body at that moment. So this is another approach where we have this person is wearing the patch on his chest, and he's also wearing a PPG device, which measures the blood actually arriving at the fingertip. So with this, we can actually calculate the blood speed so that we can estimate the blood pressure. So I think PPG would be more, I would say, applicable here, because that in Korean medicine, there's a lot of approaches where we measure the beatings on your wrist. So the beating itself is actually the blood that is arriving on your wrist. So we would know how much blood is actually arriving on your wrist, so that it would indicate harder beating on your wrist, and also the frequency would be just BPM. So I guess the PPG approach would be more familiar to a lot of folks here. So from this, we would actually develop a software where we can detect the peaks. And also, this is for another try where we use the EMG measurement system. So we also developed a software, or where I could say a game, so that it can help patients do their rehabilitation more easily or more in a fun way. So that usually these kind of rehab devices or EMG measurement devices are extremely expensive, more than a couple thousand, I would say tens of thousands of dollars. So to avoid this, we developed a system using the previous presented devices and linked it up with a video game. So you can see here that there are obstacles, and this is your game character, and here it shows your muscle activity. So when the patient is making some sort of muscle exercise, it indicates how much electricity or electrical signal it is generating, and that moves the character so that you can avoid all the obstacles. So this is another approach where we try to use EMG for some rehabilitation approaches. And now that's for the devices, and I would explain a little bit more about some software stuff. So this figure right here indicates a regular person's heart beating or ECG signals, and this figure is an example of people or person with some arrhythmia, basically some heart problem. So in this case, it's quite easy to find the peaks because it's the highest value in the adjacent time domain. But in people with a heart problem, it's quite difficult because this is not the peak. This is the peak. So how would you find out where the peak is? So this is another challenge where a lot of commercial products just assume that the person does not have any problem and all the ECG will be looking like normal. But for people who's actually having problem, you have to, or the algorithm has to be precise enough to detect the peaks, and the waveform is very distorted. So we have developed a system where, using the same previously explained devices, some algorithm to detect the peaks even when the waveform is not normal. So these are the process of detecting all these peaks, and you can see on the right-hand side, this is the I would say the process of detecting the peak. So this is the original ECG signal. You can see that it's pretty messed up. It's not normal, right? So from this, we are doing some signal processing technology or techniques so that we can actually find out the actual peaks from this distorted waveforms. So you can see that this is our result using our algorithm, and this is the real answer. So we can see that in this kind of, I would say, example of people with problems, you can actually precisely detect the peaks from the ECGs. So if we detect the peaks, how are we going to use it? Like, we're not doing this just to simply calculate BPMs for your exercise or running sessions, right? So we are doing this to actually detect what kind of arrhythmia this person is having. So this is another AI-based software where we are classifying what kind of arrhythmia this person is having. So when you're trying to detect an arrhythmia, you have to define what your beat is. So for instance, if you have this kind of signal, you need to cut this signal into one single beat in order for you to classify this beat as a normal, or if this beat has some sort of like a premature beating problem. So for that, you would have to know where the actual peak is. So we used the previous algorithm to detect the peaks, and now we are trying to classify for some given beats into 3 categories. Here, it's normal and supraventricular and ventricular beats in this case. So within the classification, there are more detailed or more specific classifications, but in our approach, we are just classifying into 3 categories because there are some limitations where if you really want to specifically define your arrhythmia beats, you need more information. So in this case, we are only using modified lead 2 ECG waveforms, but for more detailed analysis, you will need a couple more. For instance, the Holter device has 12 electrodes, but in this case, we are just using 1. So this is another approach, so where people can monitor their actual ECGs, and the software will tell the patient that, oh, this beat is normal, or this beat is V, or this beat is S. So that the real-time feedback would tell the person whether this person is having some heart problem or not. And with this kind of technology, I think if there's a cure that has been developed and there's a person with some heart problems or some stroke and he's about to have some sort of a problem, he can find out whether his arrhythmia problem is getting better or worse. So if it's getting better, he should pursue on the medication that he's taking or practicing the exercise that he's been doing for the treatment. But if it gets worse, I guess he can go visit the doctor and tell him that, oh, I'm getting more abnormal beats. So this kind of approach or technology can help people with their personal health care in their own personal way, instead of just doing what the doctor says for a couple of months and then go visiting him and telling him that, oh, I'm feeling good or I'm feeling bad. That doesn't indicate anything, because even if you feel bad, you might get some improvements to your body. You never know what is actually going on until you take some sort of a measurement. And also, this is another approach where we have developed an on-site sensitive glucose measurement platform. So I know that there's a lot of glucose measurement devices out there, but most of them use blood or interstitial fluid. So blood, you would have to prick your finger and draw a couple of drops of blood onto the measurement platform. Or recently there has been some continuously glucose monitoring device hooked up with an insulin pump, so that it would measure the glucose level, and then the insulin pump would inject insulin into your system. But even this, it needs to be deeply inserted into your body. So the needle is about a couple of centimeters. The needle has to penetrate a couple of centimeters into your body. But in this case, we have developed another system where we can actually this is so sensitive enough so that we can measure glucose from any kind of liquid from your body, for instance, sweat, urine, or tear. So in this case, we do not specifically we do not specify in an application, but we made a very small device for this kind of glucose measurement. Instead of having an analysis equipment, this little device right here can actually measure the glucose, and this is actually a sensor. This part right here is a sensor, the tip of this part actually. So by using this, our next research is applying this into like a urine bag of a patient. So in the hospital where, a person cannot pee by himself, he would have to wear a urine bag, and attaching this to the urine bag, we kind of can find out the glucose level of this person. And from that, we can probably make things much easier. And also, this kind of platform can be applied to all sorts of other applications as well, because this is just a glucose sensor in this case, but we can similarly develop another electrochemical sensors that can be applied to this kind of a measurement device. And also, there can be some acupuncture examples here as well. So conventionally, this is a device for applying electrical stimulation to a patient using acupuncture. And in this case, all this has to be wired, and the patient has to be lying down motionless usually. So you cannot run around with all these wires going on. So we have developed another system. So in this case, we developed this device right here with microneedles. So by using this, you can apply electrical stimulation to the body. So the thickness of the microneedles is about 70 micrometers, where we can penetrate the top SC of your tissue, but so that it can touch the inner tissue, epidermis. But what it does is that it can apply electrical stimulation to your body and also measure EMG at the same time. So let's look at this figure right here. This is a screenshot from your cell phone, and we're measuring the EMG of your muscle. So when you're actually taking measurement, you can see that the EMG signal is coming here, and at the same time, if you press a button, you can measure the spectrum of your EMG. Spectrum meaning that you can find out the mean frequency of your EMG signals. Excuse me. And when you're not measuring EMG, in this case, the circle area here, you're applying electrical stimulation. In the electrical stimulation, the waveform looks like this, and we are able to control the intensity of the electrical stimulation. So, for instance, we can control the pulse width, which should be the width of this pulse, and also we can change the voltage. So in this example device here, the voltage can be controlled from 12 to 25. So from this, we have developed a feedback system where there's muscle fatigue. Usually, the frequency of the EMG signal will downshift, would become lower. So if there's a muscle fatigue, we can slow down or make the intensity lower. And also, the user can adjust the stimulation by himself. And also, there are some studies for animals. So in this case, this is typical animal ECG monitoring. So you can see that the paper is not 20, 30 years old. It's old, but it's only 4 or 8 years old. So these are the conventional method where we have to stick a needle inside the foot or the leg to the mouse for the monitoring ECG, which is kind of difficult when you're trying to do some sort of a surgery at the same time. So for that, we have developed another system where we have attached 3 electrodes to the chest of a mouse or the back of a mouse. And either chest or the back, we can precisely measure the ECGs. So we have compared this measurement method with the conventional method, and we have proven that the waveform matches almost exactly the same. So we can apply this kind of approach, know that this device itself is wireless. It doesn't have to be connected to any device or equipment. So we can apply this kind of technique to animals under surgery, or we can use another medical grade wires to detect EMG. So when the mouse is actually doing some sort of a movement, we can measure its muscle signals as well. So this kind of stuff we can apply so that when you're trying to do some sort of a medical treatment to an animal, we can find out where there has been some improvement in the ECG findings or some motor or muscle activity. And with that, we have done some statistic studies. So we have extracted the HRV from a mouse, and we have induced stroke into this mouse, and we have made some comparison with the stroke model and the normal mouse model. And we can see that by doing applying some statistical model, the animal without the stroke model shows very normal. So this is the control line, and almost all the signals are beneath the control line. And for the mouse with the stroke model, you can see that there's a lot of time where the waveform goes beyond the control line. So we're doing this kind of study to differentiate whether this mouse or this animal has some problem in their brain or not by analyzing the HRV. Now, lastly, I want to introduce this wireless power transfer technology. So a lot of cases I've introduced today are wearable applications, but there are some needs where you actually have to implant your device into your body. So in that case, there can be some examples of, I guess, some pacemakers, or in animal studies, people insert a lot of implantable devices. But in all these cases, when you run out of battery, you actually have to perform another surgery to extract the device, replace the battery, and then put it back in. So this kind of limitation poses a lot of risk in the study. So in order to, I guess, solve that kind of problem, we have developed a wireless power transfer technology, where in this case, we are using large wires. So in this case, we are actually powering this TV and a Bluetooth speaker wirelessly. So these speaker and the speaker and the TV is not connected to the power cord. It's being powered by these coils. And we have taken this idea to implement it on a very small platform. So this is a typical mouse cage here. And this is, I think you cannot see it, but this is a very small coil with a diameter of 8 millimeter. So with these two coils, we are able to deliver power almost up to 20%. So our next step will be applying this technique to the previously explained physiological signal monitoring device, so that we can monitor the ECG or any kind of biomedical findings wirelessly, and also without the use of battery, so that we can monitor for a very long time, so that we may able to find some treatment from Korean medicine or some other sources, apply to an animal and see if there's any improvement in real time. And thank you for the presentation. And this is the final slide.